Tonight, a specific group of Minnesotans is being asked to consider traveling to the area where Ebola is at its worst, West Africa.
Those being urged are Liberian natives who have health care jobs here in the U.S. They filled a room in Brooklyn Center today as a congressman explained the need for more help. Susan-Elizabeth Littlefield shows us how health care workers are responding to that request and how others can help battle the virus from the home front.
This is the face of a 31-year-old Liberian nurse. This is what her mother's looks like now.
She was a wonderful person, always smiling.
She speaks of her daughter in the past tense because she is gone. She says the young nurse who lived in Liberia in September treated a baby with Ebola.
Then they started to treat her, but she didn't live, she died. Children with all parents.
This grieving grandmother showed up to ask questions in a packed room to a congressman and a state health executive.
And he's an orphan now. What become of those children?
Congressman Ellison admitted he didn't have the answer, but said he and an executive at the Department of Health would do what they can for local grieving families and for health care workers who need proper protection. They urge Liberian-born health care workers to consider volunteering in Liberia.
We need people with current medical credentials. You do not have to be a U.S. citizen to volunteer.
The request prompted great interest.
There are a lot of Liberian, healthcare professionals in Minnesota who are willing.
And great concern.
Safety, protecting your families here, and then also job security. I think it's the big thing for a lot of Liberians, Liberian Americans who want to go home.
Most agreed when it comes to Ebola. The future is blurry, but the past is clear. The Department of Health is trying to come up with a plan for our area since we have such a large Liberian population, trying to figure out how they would triage patients, even considering a freestanding Ebola treatment center. One thing the department is asking of everyone, they say get your flu shot because symptoms of the flu resemble Ebola. They say they don't want ERs clogged up with people who think they have Ebola.
When they just have the flu. Good point. Now, we know Governor Dayton had a separate meeting today on the topic of Ebola.
That's right. Governor Dayton met today with the Minnesota Nurses Association and with some first responders. Now, those were closed-door meetings. We weren't inside of those, but we do know that they did discuss what else needs to be done to get our state prepared.
All right, Susan-Elizabeth, thank you. Tomorrow, local Liberians will be joined by lawmakers at another discussion on Ebola. It'll be at 5 o'clock tomorrow evening at Cross of Glory Lutheran Church in Brooklyn Center. It's open to the public. And tomorrow morning on WCCO, we'll hear from the Minnesota Commissioner of Health, Dr. Ed Ellinger, about the latest efforts to stop the spread of Ebola. He'll be live in studio with Esme Murphy. The news is on at 6 and 10:30 a.m.